physical therapist on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together, we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Today, we're going to show you how to self-treat a knee with torn or worn-out cartilage.
Okay.
Happens with aging.
Yes.
3 simple steps. Let's get into it, Brad. So the thing is, with worn-out cartilage or torn cartilage, it's unlikely that it's going to grow back. It's not going to regenerate.
Particularly if you're in your 50s, 60s, and older. You can try some shots. The doctors have
To calm
some
it
medication.
down.
Yeah, but we're going to work.
We're going to mainly try things that are make it feel better
Right.
and hopefully help you manage the pain.
Either way, you want to get that range of motion back.
So the first thing is, quite often the knee gets flared up from torn cartilage. It might have bone on bone. You want it to calm down. So the first thing you should do is reduce weight on the knee.
Right.
So you could try a cane for a while. I'm not saying forever.
Right.
Just let's get it calmed down.
Right.
You might try anti-inflammatories too.
Well, I've got a guy right now with a hip problem, and he just won't go to a cane.
Yeah.
He really should. It'd make
We
life easier.
do kind of joke about this because I know this. I'll be the same way. You're limping along really badly, but you won't use a cane. If you use a cane, you won't limp, and you won't draw attention to yourself. Believe me, people know when you have a bad knee.
Right,
I mean, you're not hiding anything.
That cane, I always tell them it's a very distinct looking
That's right.
device,
Distinguished looking.
Yeah, exactly.
Yes.
So if your left knee, you want me to go through
Sure.
it now, Bob? The left knee is my painful knee. You're actually going to take the cane in your opposite or the right hand. So, and when the left foot goes forward, the cane goes with it. And typically, I always tell my patients, I don't tell them anything. I say, just walk with it in this hand. And usually the natural motion is they sync up and they do very well. So, and you're putting weight through the cane and off, and you're going to feel it right away.
Yes.
Because the weight through the cane is that much less, and it doesn't mean you have to take all the weight off. Even 20-30% decrease can really make a difference on
I
that
can tell
pain.
you from experience, and I've used this with thousands of people. I have.
Oh,
And
I believe you,
And
Bob.
that's the first thing we do, treatment 1, day 1, and that usually calms it down.
Yep.
I mean, sometimes that works better than anything else we do. And, eventually they stop using it, and they go on for a couple more
Right.
years.
I would imagine at your age, you'd probably up in the millions of patients.
God.
I had to throw that in
You
there.
had that one all loaded up, didn't you? Ready
I
to go.
did.
All right. The other thing is, when you're sitting in a chair, which a lot of us spend a lot of time in a chair now, really don't try to sit with let's say this is the bad knee. Don't sit with the knee bent over 90 degrees. It's compressing that knee the entire time. If it's flared up, if it's inflamed, that's going to keep it flared up, keep it inflamed. Vary it. Keep the leg straight or slightly bent.
Right.
Move it around throughout the day. In fact, the more movement you can get, the better.
Yeah, and you can pull it up and bend it more, but we're not going to hold it there very long.
Don't hold it there
for
long.
a stretch, it's
Right.
a good idea.
For stretch and for range of motion,
Right.
like this. You can do this like every half hour. Just get that knee moving like
Yep,
this.
exactly.
All right. The other thing is don't stand with the knee locked. So that I've actually seen a friend today, Brad, that he said he was standing for a while and his knee started to kill him. And a lot of times what happens is you're locking the knee. I'm going to show you what happens.
So in other words, you straighten it all the way
I got
straight
an X on there
to
from
the,
other video.
Yeah, you probably do that all the time.
Yeah.
So yeah, it's like if I'm pushing here, the knee doesn't go any farther, and we call that
Really
end,
jamming it.
yeah, end range, and that just stresses the joint more than it needs
Yeah,
to.
so what you really want to do when you're standing a lot is to get variety.
Yep.
So you might actually, you want to show the next stretch, Brad, because this is one of the things we want to keep range of motion.
Yep.
You might actually put your foot up on a chair and stretch it while you're taking a break from standing.
I was going to say, you can just go right to left.
Yep, exactly.
A little
Move it
flexion.
Yep, exactly.
If you get your foot up like this, or even on a stool,
Yep.
like when you're doing dishes, open up the cupboard door, have
Exactly.
patients put their foot up and alternate. Do you want me to show you this?
Sure.
The flexion stretch.
Yeah.
And we're talking about getting the knee to maintain range of motion so that it bends as far as comfortable.
A lot of times it feels better to do
Yeah.
this.
Now, if you do this and you get all the way to the end and it really is creating sharp pain, you're going too far. You
Yeah.
just go toward starts to stretch and just bump into the pain a little bit.
Yeah, don't create pain. We're not trying to hurt the knee. We're trying to just stretch it.
Yeah, you don't want to get it all flared up and then you'll be swearing at us.
The other thing you could do is you could actually get cushions in your shoe.
Oh, sure,
to help-
inserts.
Yeah, inserts to help. We're not talking arch supports.
No.
We're talking about just cushioned inserts.
Right.
Yep, they're inexpensive.
Right.
And you can also get a cushioned mat.
And, yeah, just make sure they say, neutral arch. There's no arch you don't have, because you may not need it. It could make things worse.
Right.
So.
And you could also buy a mat and have, Brad follow you around and put it in front of you like you'd be a king.
But
So,
these are
mat.
Yeah. This one is.
Really thick.
Yeah, and this one has some. Usually, you're going to get a
Rollers.
flat one.
Yeah.
This was actually made for some other device,
For a desk.
Yeah.
No, it was to help roll the feet and stuff like
but
that.
in a seated position, right?
In a seated
Yeah,
position.
yeah.
Generally, well, I think you do both. Standing and
Okay,
seated.
sure. Got a
So,
little bump here too.
You
Wow.
also, besides working on bending the knee, which Brad did it, standing, you can also bend the knee seated.
Yes.
You slide your butt forward,
Yep.
and every so often you do this, like every 20 minutes or so. Get pressure on, pressure off,
Yep.
pressure on.
Sometimes
pressure
it's
off.
helpful to slide the hands up closer to the joint.
You can also, this is a neat little hint, Brad. If you really
Oh,
want to work the joint, you can take a towel like this and you put it in the crease of the knee.
So right up in
Yeah,
there.
right in there. I'm going to slide forward, and now I'm going to go like this, and this gaps the knee a little bit.
Yep.
This is a great stretch to do.
It takes those arthritic surfaces and pulls them apart so they decrease
Distracts
pain.
them.
Get some synovial fluid in there, which
Yep.
is going to help.
Yep.
Again, no pain. It should feel like a good stretch. If it creates some sharp pain, it's too aggressive. You need to back off.
Right. So just keep a towel by your desk, and you can do that.
Right.
Now, we're also going to, besides bending the knee, we also want to work on straightening the knee. Especially if the knee doesn't straighten all the way out. Now, you can check this out by putting both knees down. You might see that one knee doesn't straighten all
Right.
the way. It might be the painful knee. By that, it might be very subtle.
Sure.
You want to regain that motion. That's going to help the knee. So let's say it's this one.
Yeah.
All right, I can just work on extension with the toe straight up.
Yep.
I can turn the foot out like this and try it that way. You want to see which one feels the best.
Sometimes a little rotation makes the joint loosen up a little bit. It's amazing.
So I'm pushing right above the knee. You can
Yeah.
also push it above
Yeah.
and below the knee if you want.
So he's saying not on the kneecap.
Yeah,
'cause
on the
that
kneecap.
can hurt.
So you can either work it on in, out, or straight up.
Right. Right.
Figure out which one works best for you. For my wife, it was turning out
Yeah.
like this. She really had good luck with this one. You can also use a stool. To do
If
so.
you have a stool with rollers on it, it really is nice.
Works well.
In the clinic, I always have my patients would do this, and then I would say you can kind of get the knee moving a little bit like this, and then out and gentle pressure on. I got to get my lean back, and that really works. Really works.
Now
nice.
the key to this is you could do these every hour.
Right.
I mean, and do them throughout the day, and
But probably not the first day,
not the first day.
because you might flare it up. So maybe the first day, just test it out and see how it feels.
Brad remembers I was told about a patient who almost didn't come back because he
Yeah.
really went crazy the first day, and he's like, "Oh my God, my knee hurts so bad."
So he was pushing hard and trying to get it all straight in one day,
and he was like 80 years old or
and
90 years
did
old.
he grab you and say, "Why didn't you
Yeah,
warn me?"
yeah. And he threw me down to the floor, which isn't hard at
Well, that's not the
even an
first time.
80-year-old. Yeah. All right. Besides getting the motion back, we also want to do some strengthening. And
Right.
the easiest one to do, because the quadricep gets weak on a painful knee very quickly.
And this is something you can do at home. You don't need special equipment.
Yep,
and
just take a
it's-
pillow.
They did a study on this, right, Bob?
Yep,
And found it to be
the most effective one.
Yep.
So all you're going to do is push the knee down into the bed and hold it.
So you're trying to squish the pillow
Right.
into
1,
the bed.
2, 3, 4, 5, 6, 7, 8, 9, 10. You do these a couple times a day or once a day. This is one you don't need to do that often.
Right. Right.
Do it 2 sets of 10, and you're going to be surprised.
Yeah.
That knee's going to be more stable, and if the muscles are taking a lot of stress, the joint is not taking as much stress.
Sure.
So
So did you say how many reps?
2 sets of 10.
2 sets of 10. Okay. Yeah, you might do that one day, and if you haven't done it before, see how it feels the next day. If your quad is sore, give it a day break and then come back at it.
Eventually, you might want to also do some shallow squats. Now, one way to do those is just go, if you have a bed that's higher, actually, is just to actually go down like this and hit the butt on the bed.
Sure.
And you can see I'm not squatting very deep.
Yep.
And that puts less stress on the joint.
Sure.
It is working the quads. But you can also use the ball on the wall.
Oh, yeah. I was just going to mention that, if you got a chair, a countertop,
Sure.
you can use that for balance. Obviously, you don't want to fall.
Don't take it to a painful level. Just do shallow squats.
Oh, look at this. If you happen to have
Oh, look at this.
a ball, now you don't have to have an exercise ball. You can use, it's neat, not a basketball, but something that's
Fairly large.
but a little give to it. Like
Sure.
I've had people use their grandkids' play
Sure.
balls. But a ball on the wall, because you're not putting a lot of weight into it. Get your feet about shoulder width wide, about 2 or 3 feet from the floor, so that when you go down,
You're going to find these are comfortable.
yeah, you may want to, if you got a cane or a stick or a cupboard or a chair to hold on to, it's helpful the first few
Yeah.
times.
These are really
Yeah.
pretty easy on the knee, but they are effective.
Yeah, good for those quadriceps,
Yeah.
and that's the goal. Don't go down too far. If you go down so far that it hurts, then what happens, the muscles can relax and release to avoid the pain, and then you can actually end up like this and
Yeah.
have a big problem. So be careful with that.
Yeah, we don't want anybody going down to the floor on our watch.
Exactly, Bob.
All right.
Is there another one?
No.
All right, that was a nice job. Oh my goodness, it's going to turn off.
All right. Let's see.